Essentially, a crown is simply a restoration that is a cap or a cover, and it's used to rebuild either a broken tooth, or potentially it's used preemptively to prevent a tooth from further breaking. On the contrary, you have veneers, which are a little bit more conservative in nature. They tend to be a partial cover in essence, or more or less a facing to the tooth, where the amount of tooth that has to be removed in order to compensate for the ceramic or the restoration that we're using is a lot less in the instance of doing a veneer. Same-day crowns are a huge advantage for patients nowadays, and at our practice at Select Dental, we do have the ability to incorporate CEREC dentistry on a day-to-day basis. It's a great advantage for patients. It allows them to fall into the scenario where if they break a tooth, they're going to leave that day with that final restoration placed. There's no need to walk out the door with temporaries and coming back in 2 to 3 weeks later while a lab designs that crown. So you get rid of that burden of temporaries chipping, maybe falling off, the sensitivity that comes with that. To leave that day with a proper fitting restoration is one of the best things that you can do for a tooth in order to keep it as healthy as possible.